Hi everyone, I'm Katharina Kang, Mission Programs Manager at Komen, North Texas. I'm excited to be back with you again for our monthly educational series. We've had a lot of great topics coming up we have a lot of great topics coming up for 2019, and we're glad to be supported by our social media sponsor NTT Data Inc. If you miss any of our previous episodes, be sure to check it out on either our Facebook page or our YouTube channel. Just search for Komen, North Texas. As we wrap up Black History Month, we wanted to talk to you about African American women and breast cancer. Breast cancer disparities for African American women are startling. In case you're unfamiliar with the term, disparity can mean a difference or inequality. When we talk about health disparities, we are referring to differences in health and health care between populations. Here are a few statistics that outline the disparities between African American women and other race or ethnic groups. First, while breast cancer is the most common cancer among Black women, and while fewer are diagnosed with breast cancer than white, more Black women are diagnosed before the age of 40. Second, Black women are more likely to be diagnosed with more aggressive tumors than any other racial or ethnic group. You'll remember from one of our Facebook Live episodes that triple-negative breast cancer is an aggressive form of breast cancer associated with lower survival rates and poor prognosis, and cannot be treated with hormone therapies or Herceptin because the tumors will not respond to them. 24% of breast cancers in Black women are triple-negative, whereas only 8 to 12% of breast cancers in other groups are triple-negative. Third, the overall 5-year relative survival rate for white women is 92%, but only 83% for Black women. And finally, the most alarming disparity is that the mortality rate, now that's the percentage of people dying from a disease, in the United States for African American women is 40% higher than for Caucasian women. African American women are more often diagnosed with late-stage breast cancer when treatment options are limited, costly, and the prognosis is poor. Researchers have studied why the mortality rate for Black women is so much higher than for white women. Possible reasons include biologic and genetic differences in tumors, prevalence of risk factors, unequal access to and receipt of prompt high-quality treatment, reproductive patterns, cultural mistrust of healthcare due to a history of medical racism, and later stage of breast cancer at diagnosis, largely attributed to longer intervals between mammograms and untimely follow-up of suspicious results. At Komen, we believe that the disparities of African American women face when it comes to breast cancer are unacceptable, and we're working to address the reasons for higher mortality. First, in collaboration with the Ad Council, Komen has created a social media campaign to encourage African American women to talk with their family members about their health history and have informed conversations with their doctors about their breast health. We encourage you to check out the platform at knowyourgirls.org or follow them on Facebook, Twitter, or Instagram. There are lots of tools, including a family health history tool, to help women and men of all races and ethnicities better understand their genetic risk of breast cancer. Second, in December 2015, Komen received a grant from the Fund 2 Foundation to begin bridging the gap in access to high-quality breast health care in the African American community. We are committed to the goal of reducing African American breast cancer disparities by 25%, starting in the 10 metropolitan areas that have the highest late-stage diagnosis rates and death rate disparities between Black and white women. These cities are Atlanta, Chicago, Dallas-Fort Worth, Houston, Los Angeles, Long Beach, Memphis, Philadelphia, St. Louis, Virginia Beach Tidewater, and Washington, D.C. Finally, Komen is committed to achieving health equity for all races and ethnicities. Health equity is ensuring that everyone has full access to breast health opportunities that enable them to lead their healthiest lives. In case it's still not clear what equity means, think of a group of people who all need shoes. Equality would mean giving everyone the exact same pair of shoes. Equity means giving each person a pair of shoes that is the right size and shape for their own feet. Health equity has not been achieved in the United States, but at Komen we are trying to ensure that we are working with groups that remove barriers to care like location, language, age, education, socioeconomic state, and more. Over the past 15 years, the mortality rate for Black women has been decreasing, but we still have a long way to go to reduce the disparities that they face, and we can only do it together. I'd like to introduce a new segment that we will end all of our Facebook Live videos with, a Komen Scholar Spotlight. The Komen Scholars are an advisory group of 59 distinguished scholars and leaders in breast cancer research and advocacy. Each has made significant contributions to advancing the field or demonstrated significant promise of doing so in the future, and all are committed to furthering Komen's mission. Our Scholar Spotlight this month is Dr. Julie Palmer. Dr. Palmer is a professor of epidemiology at the Boston University School of Public Health and associate director of the Sloan Epidemiology Center at Boston University. Her research interests focus on racial disparities in the occurrence of hormone receptor negative breast cancer and in breast cancer mortality. Dr. Palmer is a founding leader of the Black Women's Health Study, BWHS, a prospective cohort study of 59,000 African American women who have been followed since 1995. Her breast cancer research within the BWHS includes work on risk prediction models for breast cancer in African American women, identification of childbearing patterns as a contributing cause to the excess incidence of estrogen receptor negative breast cancer in African American women, and investigation of the relationship of type 2 diabetes to breast cancer risk and prognosis. Dr. Palmer received the Komen-funded AACR Distinguished Lecture on the Science of Cancer Health Disparities in 2017. Dr. Palmer's Komen Scholar Grant supports work on determining the interrelationships of family history, genetic susceptibility, including BRCA1/2 mutation status, and modifiable factors on prediction of breast cancer risk among African American women. You can learn more about our Komen Scholars and their work they're doing at komen.org/scholars. One final reminder before we sign off for today. Registration is open for both our Komen Scholar Series and our North Texas Race for the Cure. The Scholar Series will be on April 12th at the Lincoln Experience Center in Frisco and will spotlight Dr. Adrian Lee. The Race for the Cure will be on Saturday, May 18th at the Start in Frisco. Register today and find more information at KomenNorthTexas.org. Thanks for tuning in, and thanks again to NTT Data Inc. for sponsoring this Facebook Live educational series. See you next month.